our employee it probably have as good a coverage as anybody in the United States. You know, this county side, a buddy here who's fixing to get really loaded with this, all I constantly hear is, how come our insurance is not good as the city's insurance? So you get to deal with that, Mr. Zane.
Looking forward to it.
But it has due to the gap. We're absorbing the difference. You know, the co-pays, the big deductible. What do we have? $5,000? $6,000 deductible. The city's taking care of, so we're absorbing that.
Surprises me the number of people that have their years to retire like I do, but years to go to get Medicare that are working just for insurance coverage.
Yeah.
And I work with the school system, and we've had big insurance problems. And it was really came down to where we thought that our retirees were going to take a terrible hit with their insurance. People currently working still were going to be all right, but those retirees were going to take a terrible hit. And because gap insurance came through for us, that didn't happen, but it was very close to happening.
Well, you know, in my, of course, I didn't have the insurance till I was 39 years old. I had 2 children born. The first one cost me, I think, $1,100 to have a child born in the hospital. You know, I paid that and was able to do it. And I paid for what little hospitalization we had. My wife now, we're blessed with good health. But what do people do now that don't have that, you know, Medicare, of course, it's, like I say, it's going broke, but affordable care is sort of a thing in the past. If you've got money and are not insured in some kind, there's no such thing as affordable care unless you're a multimillionaire, it looks to me like.
This falls into the scenario, Mayor Stevens, that Sarah Skinner was given.
That's right.
You know, they don't go to the doctor until they end up in the emergency room, and then it's something catastrophic. They just held off as long as they can.
Yeah.
But you know now, and then the other thing is, a lot of people have to choose, do they pay their insurance, do they feed their kids? Or do they buy their medicine? Do they go to the doctor, or do they get the medicine? Or do they go to the grocery store?
Yeah.
You know?
Well, that's because the insurance costs more, and it's going up again.
Everything.
And then, you know, the cost of care is more, the reimbursement rate is less. So there are fewer people, like the mayor said, that actually will take those enrollees. And then the hospitals, with their emergency rooms, they're getting people that are really, really ill. They put it off because they can't afford to get the care.
You know, back to the point of Obamacare, as an employer, you know, we've had what we call a catastrophic plan for our employees that have to make those choices so that they at least have some level of coverage for a catastrophic event. And thank God, because they've delayed the employer mandate, we've been able to keep that. But of course, once the employer mandate kicks in, we're no longer going to be able to keep that. And here we feel like as a business, we've tried to make the right decision for our employees, because most of our employees, even though we do contribute to the premium, they can't even afford that. And so, you know, we've added that other level, and it just to be, what, you know, if they would just let us as business owners make the choices, and I think a lot of businesses have tried to do that. Because, you know, even if you pay half of the premium even for single, a lot of them still can't even afford that amount. Or they choose, they've grown up where they've had other options, and so they don't even want to choose that option. So it's just, it's one of those, you know, I mean, thank God they delayed it. I mean, for our little business, it would be, you know, it is going to be catastrophic when we have to make some really tough decisions.
Right, well, see, and it's just so ridiculous because the federal government is mandating you to provide something that when you give it, when you provide it for your employees, they can't afford to use it because it's too expensive to use. You know, we talk a lot about things being too expensive to afford. But health insurance is getting to be too expensive to use because they can't meet the deductibles and they don't have the out-of-pocket.
Well, and then we hear all the time they come over to the emergency room because they don't have to pay anything. I can't go to my primary care because they're gonna want me to pay my copay, so I'll come to the emergency room, I don't have to pay anything at the
Right.
emergency room. You know, so, and they use us as primary care, they come for their blood pressure medicine and their.
Let me ask you this, when Dolores was at the other meeting, well, go ahead before we move on.
I just want to make a comment. I think for the HMOs, there needs to be some sort of truth in advertising kind of thing that really lays out sort of the fine print comparison. And as far as the community, I think it's probably going to have to be the local leaders. For us as healthcare providers, there's a fine line when we're contracted with them.
Right.
As far as what we can present to them, and we have to be very careful how we're presenting to a patient what's out there, because they can come back and say, well, you're trying to lead a patient to change insurances. And we're very upfront with that, and we're not trying to lead them, we're just saying, here's what's out here. But on the copay thing, every so often we hear these conversations about MedPAC making the suggestions for or recommendations for home care, for just traditional Medicare and the copays. Are you hearing that grumbling or those suggestions more? Feedback?
What we hear more than anything else is complete dissatisfaction with the whole ball of wax. Because people don't know what they want. And they didn't understand, they had heard all the hype that the new insurance was going to save them money. And that Medicare, the seniors heard, oh, we would never cut Medicare. See, so that's what they heard. And I think a lot of the problem rests in that. Because people say, well, but we were told that insurance was going to cost us less. And we were told that we were going to get more Medicare benefits. And so they think there are new plans that they're buying that are enriched plans. And then when they get to the hospital or the nursing home or the primary care physician or a long-term care facility, what do they find out? You know, that is the point. When they try to use it is when they find out that it does not cover what they thought and understood was going to be provided.
Do you see a push though in Congress and stuff for that more? Because I just, that seems to be a proposal that different ones keep offering up as a solution.
Well, what we're trying to do, if we can get